we also had to make it practical. How can you put it into the hand of a clinical team member in a practical way that doesn't disturb the relationship, but is non-intrusive in it? And so we developed what we call ambient listening. We call it Canary Ambient. We do real-time streaming in a multi-mode analysis. And we could process, of the diseases that I mentioned, we could process any of them on 40 seconds, or we can process all of them on 40 seconds. So we give back information while the doctor and patient are still talking. We give back information on any of those diseases. What is the behavioral health? What is the cognitive health? While they're still talking to each other. And that information is clinical decision support. So it's part of the array of information a doctor has, their experience, the other tests they're doing, their conversation, their questions, how they're answering them, their observations, just like we do with our children. But now they also have an objective measurement based on vocal biomarkers. And they look at that, and that may steer the next question, or it may help them formulate what they decide that the diagnosis is. So that's how Canary Speech pursued it. There were several companies in Toronto. There was a company that pursued Alzheimer's disease. In California, there were two companies that pursued just behavioral health. And they pursued it differently than we did. We use conversational speech only. Mm-hmm. So we could be doing an assessment in this meeting from words that I'm speaking, and it doesn't matter what those words are. Most of the other players followed kind of speech pathology, which was a very structured analysis for a good purpose. You had a deficit in your speaking, CHs or SHs or whatever it is, and they give you a paragraph that challenges you to say those things, and they can identify where the deficits are.
That's right.
But that uses a different part of the brain than behavioral health. And so by doing that structured speech, you're actually not helping yourself. So we use just conversations happening between a doctor and a patient. We're listening to that conversation. We're separating those voices. We're identifying them. We're doing quality assurance along the way. And then feature extraction. We look at 2,590 different features every 10 milliseconds, all below the word level.
So are these solutions, are they networked together? Can you take advantage of them? Or is it from a training perspective for the models? Or are they centralized per hospital, per doctor, per clinic? I don't know how you have it distributed.
So wherever a conversation between a doctor and patient is occurring. So for instance, in the Microsoft Dragon Copilot platform, they're doing clinical dictation notes for a doctor. So while the doctor and patient are talking, they're listening in an informed consent, they're listening to the patient and they're listening to the doctor, and they're creating notes for both of them. Accurate, very accurate notes. Mm-hmm. They're also providing them with other information. What we do is we're fully integrated into the Microsoft Dragon Copilot. We're fully integrated into that. And what we do is simply listen to that same conversation. And after 40 seconds of patient speaking, and it can be 8 seconds here and 12 seconds there and 10 seconds here. And we're intelligent enough to know when we have 40 seconds, we process it, and within milliseconds, the doctor has on their handheld device, either the Epic Haiku or on the Dragon Copilot device, they can see the scores for that whole range of diseases, or whichever ones they selectively pick. So maybe it's behavioral health or postpartum depression, or maybe we're analyzing MS or Parkinson's. Mm-hmm. So we can do this as a selective group of illnesses, or you could do it like a blood profile, where an individual gets an entire profile, a dozen different things. By the end of next year, it'll be 24 different diseases that we analyze for. So what we tried to do is create something that could function in real time, that could function in a non-intrusive way. So we're not interfering with the conversation.